And we've got some new COVID-19 case numbers in the Pacific Northwest. So let's look at what we know and what we don't. Oregon reported 48 newly confirmed cases today and no new deaths. And this graph here shows the cases since the pandemic started. Now, the vertical lines are daily cases and the blue dots that you see are a 2-week average. And you see that slope is on a downward trend. The tricky part here is we don't always know exactly when some of these cases started. Not everyone reports illnesses right away. So there's kind of a gray area about where some of the new cases reported today may fall on the timeline. Now, in all, Oregon has reported a total of 4,029 positive cases and 151 people have died. Now here's Washington. Washington's numbers are reported a little bit differently, and this graph shows the data of when symptoms, the date rather, of when symptoms started, so it's a little bit behind. Now, the latest numbers from the 20th show about 180 new cases, but the average, those blue dots again, showing a downward trend like Oregon. So far, Washington has reported a total of about 20,800 confirmed cases, and 1,106 people have died. Now, as both Washington and Oregon open up, I asked Dr. Ken Steadman, a virus expert at PSU, how he feels about what these numbers that we're seeing. And he says the percent of positive tests is headed the right way.
Oregonians are doing an awesome job because our numbers are very low. Even though those absolute numbers may be staying pretty stable, the amount of testing is actually going up. And so that means the relative numbers that we're seeing are actually going down.
So if we're trying to avoid another spike down the line, how do we keep those numbers low? Here's his answer.
The way that's going to happen is if we're going to have widespread testing and people responding to, if you are sick, someone asks you if you've been in contact with someone, let them know, because that's not only going to help you, it's going to help everybody you know and your family and everyone else.
That's basically the process of contact tracing, and that's the part of the challenge when breaking down these numbers. Dr. Steadman says there's usually a lag of about 5 days between someone's symptoms and testing and knowing the results, so that makes backtracking that much more important.